All right, the Daily Telly, you're out of order. That's the headline. Health hazard. Gee, what a headline. Lax health orders, which allowed the limo driver at the centre of the crippling COVID outbreak to escape police action, are still hopelessly failing, with a former DPP boss saying some are unenforceable. Nicholas Cowdery singled out an order that requires a mask near a cafe, saying it was too imprecise, after the Premier was spotted barefaced while waiting for her boyfriend to buy her a coffee. Health Minister Brad Hazzard now says the rules are given as a guide. Look, Ollie, this is an interesting scenario in New South Wales. Gladys Berejiklian has been touted as the gold standard when it comes to her response, both health and fiscal, to the pandemic. But now we're very much into, a dire situation, and I'm not overstating that. It is a dire situation in New South Wales. It's sitting on a knife edge. We are in a situation in New South Wales where the replication of Victoria is real and possible unless they get this under control very, very quickly in the next 72 hours.
And you've got to throw the gold standard now tag out the window. I think that's probably flown. And one thing I still struggle to grapple with, to be perfectly honest, Gleeson, with this, Bondi cluster, why the New South Wales government just didn't shut down the eastern suburbs. They took that decisive action over summer, shut down the northern beaches. It obviously caused a fair bit of grief and heartache for families on the northern beaches, as a lot of Sydney had other restrictions, but they still were able to move around the city. It's a sort of half, hazard response in the end in Sydney, and unfortunately now that the repercussions for our most populous state is quite severe, and it's going to be prolonged. It's almost indefinite, and that's obviously now travel to Victoria. As we know, Melbourne's lockdown is going to be extended. As I mentioned before, things are on a knife's edge as well in South Australia, in Adelaide. So I know some pretty tough calls have had to be made in New South Wales, particularly over the weekend, now closing down building and construction sites for a couple of weeks. But this is still a worrying trend, isn't it? The case numbers bubbling around that 100, the community cases infected bubbling around 20 to 30. I looked at the exposure sites, Gleeson, in the last hour that had just been updated by New South Wales Health, and there's a worry. It is a concern. We're talking about Parklea Market, so the big fruit and vegetable markets. We're talking about train lines as well, and these are not results that you want to see every single day. So the work's cut out for all these contact tracers. I know that even there's assistance being provided by West Australian contact tracers, Gleeson. Whoever would have thought that the West Australians would be helping the New South Wales men and women try and contain this COVID-19 outbreak? But look, it's a weird scenario right now. As I sit here talking to you from Perth, we live in a restriction-free society. We will have 60,000 people at the football on the weekend. We don't have a 2 square or 4 square metre rule. We have absolutely nothing. I can have 350 people over to my home on the weekend if I knew more than about 6 or 7. But it's just bizarre that here we have on the eastern seaboard a very, very different scenario playing out. And I just hope everybody obviously gets on top of it as soon as possible.